Hello, I am Dr. Sneha S, Consultant Internal Medicine at Manipal Hospital Sarjapur Road. Today, I am here to talk about vaccination in the geriatrics or elderly people above 65 years of age. Adults also need vaccinations like children to boost their efficacy of their childhood vaccines and also to aid them in keeping their immunity good against vaccine preventable diseases. As we age in elderly, especially, vaccination is very important as the immunity weakens and their capability to fight infections becomes less. So the elderly are more prone to have severe infections, and with the help of vaccination, boosting their immunity helps them combat these infections at a milder level. The elderly required vaccinations against three most common diseases, that is the flu, the pneumococcal which causes the pneumonia, and the shingles or the zoster. These kind of vaccinations are predominantly important in people who have diabetes or other related illnesses, heart diseases, chronic kidney diseases, and those who are on other forms of therapy which can weaken their immunity. So the first, let me talk about the flu vaccine, which has to be taken once a year, especially around the season or months of October to November. So, and these shots have to be repeated annually. So the flu vaccine is an annual vaccine. The next is the pneumococcal vaccine, which is available as two forms, the pneumococcal 13 valent vaccine and the pneumococcal 23 valent vaccine. So these vaccines in recommendation or in consultation with your physicians can be administered, and usually they have a time gap of 5 years after you take the 23 valent vaccine for the next repeated dose. The zoster vaccine or the shingles vaccine, which is currently available, also provides good immunity against the shingles or the herpes zoster, which we are seeing on a rise these days. The vaccine is taken as 2 doses 4 weeks apart and does not require any booster doses in future. So please, if there are any elderly at home, please make it a point to get them vaccinated so that they have the immunity boost against these infections, which helps them from suffering due to these infections and avoiding hospitalizations to a great extent. It also helps the other household by keeping the immunity under check and spread of infections. Thank you.